My outlook on LASIK, especially nowadays, is extremely positive for many factors, most of which is that I've seen a lot of patients here at our practice over the years, and I've watched them, and I know when they're ready to have LASIK and when they're ideal patients. I can tell if their eyes have stopped changing, I can tell that they don't have dry eye problems, I can tell they're about the right age. We've tried them in contacts, we've done all we could, and contacts are not an option for them for whatever reason anymore. Glasses are cumbersome for them. So from that point of view, from a functional point of view, I feel comfortable knowing that they're ready to have the procedure. And then from a physiological point of view, I just couldn't feel any happier about the state of their corneas and the ability of our surgeons to do LASIK with virtually nil problems on the whole. So I've seen the success rate of LASIK go through the roof if the patients have been carefully watched and taken care of. My role in the LASIK journey, I kind of feel like I shepherd the patients through it. I don't do the procedure itself, but I've watched historically them kind of grow up and grow into the need for it. So I know their characteristics, and I know any small problems they might have. I also know their personalities pretty well, and I know if they've got the kind of expectations that can be met well by LASIK. And then the thing we do the most is that we take 100 measurements on everything, and we check with the surgeons back and forth, and we discuss what the best options are for the patients, whether it's monovision or just distance only. And after we've discussed things and measured them and re-measure them again, we proceed with everything, and we just don't have any trouble. So it works pretty well. The theme you see in patients who have had LASIK is almost twofold, where initially they love it, and they're just awed by it and wowed by it. And then after a while, they grow with that becoming their norm. And their norm is brilliant. They get up and they do whatever they want, they don't have any problems, they go on with other aspects of their lives, they're more active. And then every once in a while I'll see them, and if they have a little bit of a problem with their eyes or something, I'll just once in a while pull out some old lenses that remind them of where their glasses used to be, and all of a sudden, bam, the wow factor pops right back in, and they're just still extremely impressed with how they're doing. I enjoy seeing the happiness in my patients when they come back year to year for their regular healthcare exams, because over the years they've kind of understood the importance of those things, and they'll come back and they'll return with great vision, and we'll see how they're doing, we'll see how much easier their job is, they'll see how much more they like playing sports. We'll see how it's just become a much freer, active lifestyle for them. And if they do have any problems that need managed, whether it be dry eye or a little touch-up or something, we know each other well enough to where we can design how we best want to go about it, and within their expectations. And I've got lots of happy patients that just do phenomenally with it, at different ages too.